Hello, everyone. Thank you for joining us today. Today, there are over 6 million registered medical cannabis patients across the country that depend on state medical cannabis programs for access to their medicine. However, ensuring the safety and quality of cannabis products remains a paramount concern, especially as the industry continues to grow. Robust regulation of cannabis testing programs play a crucial role in protecting patient health by identifying potential contaminants and providing accurate labeling of cannabis products. This report that we're going to go over today examines the existing disparities in cannabis testing programs across various states as they relate to other regulated products, with a particular focus on the impact of patient well-being. While cannabis is inherently safe, and much safer than many other medications out there, as with any other agricultural product, cannabis plants are susceptible to the accumulation of pesticides, heavy metals, and microbial pathogens during cultivation and processing. Currently, testing of cannabis products is inconsistent between states, with differences in the compounds and species that products are tested for and the limits for those substances, as well as varying methodological and reporting units. This report delves into potential health outcomes associated with contaminants commonly found in cannabis products and provides a comprehensive summary of testing requirements across different jurisdictions and explores essential criteria for testing laboratories. By examining the importance of testing cannabis for contaminants through the lens of patient safety, public health, and prevention, this report underscores the need for robust testing frameworks and regulatory mechanisms. So joining us today, first of all, hello, my name is Debbie Churgai. I am the Executive Director of Americans for Safe Access. Steph Shear was supposed to join us today, but unfortunately, she's unable to speak right now. She has no voice, so she wasn't able to join us. However, we also have Dr. Vinocur is a board certified emergency physician, a recognized television medical expert, and was appointed just recently by the Governor of Maryland to the state's newly formed Cannabis Public Health Advisory Council. She is frequent guest lecturer, grand round presenter, and author of Ask Dr. Leigh, column on Green State that answers readers' questions related to medical cannabis. Thank you, Dr. Vinocur, for being here. And we also have Shelby Huffaker, public health researcher. She is located in UC San Diego, and her specialty include cannabis harm reduction and implementation science. Thank you, Shelby, for being here. So today we're going to go over a little presentation, and I'm going to try to go over a little bit quickly so that you guys can have get your questions answered at the end. So if you have any questions during this entire presentation, please feel free to use the chat, or there is a Q&A function below, which will keep your question private. So if you'd rather have your question answered that way, you can just click on that and ask the question, and only the panelists will see your question. And then throughout the presentation, again, Shelby and Dr. Vinocur will be able to, anytime they have something to add to the presentation, I just want them to jump in anytime. So at first, we'd like to start off with just the definition of a medical cannabis patient. I know that sounds simple, but there's so many people that actually just don't understand what a medical cannabis patient is. They just kind of think it's everyone. But a medical cannabis patient is a person living with a medical condition or experiencing symptoms for which cannabis or a cannabinoid-based therapeutic is the only treatment option, a more suitable option, or works as an adjunct treatment, including side effect mitigation to other available care options. This view right here is the current view of state laws. And by this map, it literally only shows 5 things. If there's medical and adult use available in a state, if there's a medical program only, if there's limited THC program, a CBD only program, or if there's no medical program. However, as you guys know, laws and regulations differ greatly from state to state. So while there's only 5 colors on this state, the laws and regulations for those programs would probably cause about 250 different colors if we colorized it. So this is a simplistic view of the accessibility of cannabis as medicine and the adult use by state. There are over 6 million registered cannabis patients as of today, and that number is growing every single year. And these are all the approved condition lists throughout all the states. Now, several states have it where a doctor can recommend for any condition they see that's viable, but there are several states where you have to have an approved condition prior to a physician recommending cannabis. Living with cannabis means that patients require their medication to control the symptoms of their diseases or conditions, enable them to carry out essential life activities such as work, school, and childcare. Daily use of cannabis is often required to maintain symptom relief and overall well-being, and any interruption or inconsistency in their medication can have significant consequences for their treatment success and quality of life. However, living as a medical cannabis patient also means restricted job and travel opportunities. And as you all know, medicine is 100% out of pocket. And those are just a few of the many barriers patients are currently facing. So ACE's 2022 State of the States report, which analyzes every state program on a number of factors, confirmed the disparities in state programs and highlighted the need for improvements. The states average a score of 44% in the consumer protection and product safety category, making it one of the lowest scores categories in the state. Maryland received the highest with 84.50%, but as you can see, the average score was only 44%. And on the right there, you can see some of the things that we grade for, but so let me go to this next page. Here's the rest of them. So we do this for every single state and jurisdiction. Testing programs in different states exhibit significant variations in terms of the types of tests required, contaminants tested for, acceptable levels of contaminants in cannabis products, and procedures for handling failed tests. This creates a concerning disparity in the quality and safety of cannabis medicine available to patients and consumers. For individuals with compromised immune systems, pediatric patients, or elderly patients on multiple medications, the presence or absence of the contaminants can have a profound impact on their well-being. Here's just a slide of where every single state scored on the consumer protection and product safety. So you can just take a quick snapshot of what your state got. As you can see, some of them are as low as 24%, 14%. Again, Maryland was the highest with about 85. So we're going to start simple here with states that require just the laboratory name on the cannabis labels. You can see just that is, most of them do not even require that. And here's some required testing. All these charts and graphs indicate outside of potency testing, many states fall short when it comes to evaluating the identity, strength, and purity of the products. And I'm going to show you one more slide here. This is just a graph of kind of the slide before, which shows you the percentage of states requiring each of these tests, as cannabinoids being the highest, terpenes surprisingly being the lowest. Accreditation requirements. There are numerous standards to which laboratories may need to comply with. The most common is ISO 1725025 standard that you can see here. Several states require it and several states don't. So potency, while most states require some level of potency testing, they are mostly just for the 5 most well-known cannabinoids, which is THC, THCA, CBD, CBDA, and CBN. Do you guys have anything that you wanted to add, Shelby or Dr. Vinocur, about the potency requirements? As you can see, Although most states require it, they only require it for a certain amount of cannabinoids.
I can speak to it a little bit. So we know that there are over 100 different cannabinoids in the cannabis plant. And, fortunately, the research is starting to do a deeper look into many of these cannabinoids, aside from THC and CBD, which we've heard the most about. But the emerging evidence really shows that these cannabinoids, these minor cannabinoids, as you might call them, do have therapeutic value. And so it's really important for, patients who have strains that work well for them and those that don't, to be able to see what cannabinoids are in their products. And the same goes for terpenes as well, which I'm sure we'll get to. But Dr. Vinocur, was there something that you wanted to add to?
No, it's just that, we're talking about safety and contaminants is a big issue, but for patients, consistency, as you pointed out, Shelby, is a really big issue. And plants are not factories, they're botanicals. And all of these cannabinoids and terpenes are secondary metabolites, meaning that they protect the plant. They're not really there originally for our benefit. While they do have therapeutic value, they protect the plant. So you can have, one grower be growing a certain strain, but if there's any variation in the temperature or the lighting or something happens there, there's going to be a change in those cannabinoids. And I've had patients tell me that they got the exact same strain from the exact same place, and it worked one time and it didn't work another time. And that's probably most likely that they didn't know every other minor cannabinoid, as you pointed out, or every single terpene when you're talking about flower. And because they're plants, they're not factories, and those can vary greatly. So the more information you have on that, the more consistency you have. And that's a key when you're talking about a medicine.
Yes, thank you. Thank you both. And as Shelby had mentioned there, when states started testing these, there was only those 5 main cannabinoids were mostly known, but now as science catches up with us, regulations are falling behind. So homogeneity, I hope I said that right. While most states require some level of potency testing, many fail to require homogeneity testing, which describes the distribution of cannabinoids within the product, particularly products that contain more than one serving, such as a chocolate bar or a liquid beverage. So the distribution of cannabinoids should be such that each serving contains the same amount of each piece. But as you can see here, not many states test for this yet.
And that's very important. And say, for an example, an edible, it isn't just the serving. One edible might have X amount of say THC in it. But, sometimes because it is expensive, people might buy a higher concentration of it so that they can cut it in half and quarters to get the dosing they needed. And if it's not homogeneous in the way that the gummy or whatever the edible is made, then you might be cutting it in half and quarters, and one quarter might have no THC in it, while as another quarter could have 3/4 of the THC, and then you're overdosing. So that's why in products, even in products where there's a single serving, like say a gummy has X amount of cannabinoid in it, you still need it homogeneously throughout that one little piece so that you can cut it in fractions if you need to.
Thank you. Yes. And I think, again, this is another example of where science has caught up ahead of the regulations. And again, like as Dr. Vinocur was saying, the impacts of incorrect labeling can cause backslides in treatments, interruptions in work and school, discomfort, and a decline in symptom relief. And you might not understand that the dosage that you took, even though it seems similar to the dosage you took prior, might have a different dosage amount in that particular piece of an edible or edible. So potency inflation issues. Because many states do not require cannabis testing to be conducted using standardized methods, a growing issue is that many labs are using techniques to artificially inflate potency of products and in order to increase their market value and satisfy clients. In Washington, Nevada, and Oregon, an investigative review found that the distribution of the THC content tested in tested products jumped at the 20% mark, which indicates that some labs are engaging in practices to produce results that increase the market value of products to remain competitive with other labs. Some states, such as California, have introduced regulations that would address potency inflation by requiring the use of standardized testing methods. Terpenes. Terpenes have been shown to have medicinal value, and as such, they should be identified and quantified to provide additional information for patients and consumers. The interaction of cannabinoid and terpenes provide more medicinal benefit than single molecule compounds. With only 8 states requiring disclosure of testing, COAs, certificates of analysis, which would list terpenes, patients and consumers do not have access to all the information needed to make informed decisions about their health. Anything you guys wanted to add about terpenes? I know we were kind of slightly talking about it before.
Yeah, I mean, it's important. We talk about full spectrum products that have a range of cannabinoids, but also a range of terpenes. And it's that entourage effect where they synergistically can act almost better than, as you said, single products, and they kind of work together in synergy. So it is important, especially if you're doing it if you're using cannabis medically as a medication. You know, we know a lot of the terpenes, they have sedating effects, they have anti-inflammatory effects, they have, you know, so knowing if there's terpenes in there, I mean, maybe you can use less of the product if they're synergistically working together. And if you get one product that works one time and one that doesn't work another time, and you're not sure why, but the actual cannabinoids listed are all exactly the same, perhaps there's a difference in terpenes. And as we said before, terpenes are made by the plant to protect the plant. So if there's a change in the growing environment, that can change the terpene level.
Yeah, this is definitely an issue I hear from patients the most. They want to know this. Believe me, they want to know the terpenes that are in their medicine. And it's for educational purposes too. It really helps them kind of decide what medicine to use and how to use it.
Yeah, and if I could just add, I think you both said that perfectly. And I think that this particular issue really underscores how we're kind of in, you know, to use the overused term, the Wild West. But it's true because we haven't really had any sorts of, you know, medications that we regulate nationally that, you know, you would require terpene testing. So that's why I'm really excited about Americans for Safe Access's comprehensive medical cannabis legislation, which I'm sure we'll be getting to later as well.
Yeah. Okay, so now we're going to go through some contaminants and the symptoms that they could cause. So we're going to start out with pesticides. Pesticides are the second most required test of all the contaminant tests, with 34 states requiring some form of them. I'll show you the states in a minute. However, what that form takes can vary dramatically from state to state. At this time, there are no pesticides approved for use on cannabis by the EPA. However, there are 58 biopesticides and 1 traditional pesticide approved for use on hemp plants. So this contaminant symptoms can cause endocrine disruption, neurological disturbances, and affect reproduction and development, and can be carcinogenic. And of course, symptoms are more severe in children, elderly, and individuals with compromised immune systems. And here are the states that require pesticide testing. Again, this is the second most required test. So take a look if your state is not one of them.
And if I could jump in again, just to say that it's my understanding that in Canada, where they have a national framework for regulating cannabis, my understanding is that they do not allow any pesticides to be used on cannabis. And you can compare that to California, where we have, the last time I checked, the most rigorous standards for which pesticides can be used. And I believe that's still 20 different kinds of pesticides. So there's a long way to go.
Yeah, I think, because it's not federally legal cannabis, you can't become certified organic. Now, hemp products can be certified organic. The USDA does allow that now after the Farm Bill. So hemp products, you can find organic products. I also see that there's very deceptive advertising sometimes where, there are certain places where they'll say the cannabis is, if it has more than 0.3% THC, then it's cannabis, it's not hemp, and that it's organic. And that's just not true, because the organic determination comes from the federal government, which is the USDA. And there's no national standard of what's the minimum amount acceptable. So, I always do tell patients, if they're going to buy hemp products, to, make sure that the hemp product has a COA that they can look at, and to try and find organic hemp products, because, they'll be using the USDA for no pesticides, but it is very hard, with cannabis products too.
Thank you. This is the common cannabis pesticides with the EPA action limits. For those of you that take a look at that. Heavy metals. Heavy metal testing is required by 30 of the 42 states and territories. However, as with the other test types, heavy metals testing requirements across the states do not consistently follow a single standard. Symptoms can be interruption in cellular functions and brain neuron development and growth. And I will show you here.
Oh, I'm sorry. I was just going to say, the other issue with cannabis is it's a heavy metal aggregator. So the plant itself, the water you could be using might not have been tested and could have some heavy metals in it, and the plant aggregates it. In the past, hemp and cannabis were used as agricultural remediators. You would plant a hemp field in between your food crops, because it would suck up all the heavy metals in the soil, and then it was okay to plant different food crops. So that's another issue with cannabis and hemp, is that they actually aggregate heavy metals. And
thank you for mentioning that. And I wanted to also say that in our report, there is a lot more information about each of the contaminants we're talking about. And so if you do want to learn more, because we're just kind of going over it briefly and saying which states test for it. But what Dr. Vinocur was saying, and there's lots of other information in the report. And if you do want to learn a little bit more, I do encourage you to read the report. Shelby, did you have something to add?
I was just going to say that hemp has been used to remediate sites that have radioactive fallout as well, which I always think is kind of fascinating.
Right.
Great from an environmental perspective, not so much from a consumer perspective.
Yeah, I was about to say. Extraction solvents. 35 states requiring residual solvent testing. It is the second most required contaminant test. The classification of different solvents is based on their known toxicity. And we go into great depth of the different levels in the report. So if you want to kind of see where each one stands, you can go through the report. Establishing residual solvent testing requirements that protect patients as well as employees, critical, as evidenced by the vaping crisis in 2019 and current and past vape product recalls, which there are several. States must also revise their regulations about the types of substances that can be added to concentrates. For example, vitamin E, acetate. Has been banned in some states, and others are now requiring testing for it.
Right. The issue with vitamin E acetate, when the lung problem that we all heard about in the news that kind of got buried after the pandemic started, because we had many other lung problems related to that. was vitamin E acetate is a food additive. So when you consume it orally, it's okay. It's safe to consume, but people were putting it in vape cartridges, and then you have vitamin E acetate you're inhaling into your lungs, and it was not meant to be approved. The FDA approved it only for oral and for food, and that's part of the problem. And that's the issue too with cannabis that we don't think about, because, you know, there's edible cannabis and even some contaminants, bacteria, things like that. If they're below a certain threshold, our whole GI system has the most immune cells in our whole body, so it can handle it. But if you're inhaling it, then it can cause a whole different host of problems. So.
Thank
And
you.
to add
Yeah.
on to that as well, another issue that we've seen gaining some traction is related to, you know, food additives in vape products. And
Right.
similarly, a lot of states do not regulate. I'm actually not sure if any states regulate whether or not vapes can contain botanically derived terpenes. So terpenes that may have been derived from food products like, you know, citrus or pine or anything like that.
Right.
And so while we know that cannabis, naturally occurring cannabis derived terpenes are safe, we don't know so much about, you know, the addition of these food grade products, and especially, you know, at the levels that they're present in those products, and their effects on the lung as well.
Thank you. And again, I just want to stress that even though this says there's two colors, pink for it tests and gray for it doesn't, what the limits that it tests for and what it tests for does vary in the states. So again, it isn't just a black and white issue for most. Yeast and molds. So now we're going to go over some microbiological contaminants and some symptoms they may cause. So yeast and molds. And again, these symptoms, allergies, sinus infection, pneumonia, asthma, you may think you're just getting sick. You may think that, you know, you're just not feeling well, and not connect the dots that it's maybe the medicine that you're taking, the products that you're taking. Again, sinus and lung infection, allergies, lung inflammation, this is a type of gray mold, gastrointestinal discomfort, stomachache, cramps, diarrhea. Again, things that we've all experienced that you might just say, I'm just having a bad day, or I ate something that didn't sit well with me. Could be because of the cannabis that you're taking. And again, all these are even worse when you buy things from the gray market. States have certain requirements for testing in their licensed dispensaries and licensed retail businesses. If you're buying something outside from a licensed business, you don't know if it's been tested at all for anything.
Right. I know we're going to get to aspergillosis in a minute, but I've seen cases of very severe illness related to that.
Okay, yeah. Well, let's definitely talk about that. I think it might. Fever, vomiting, risk of seizure, coma, stroke, all these things could be caused from contaminants. Here we go. Sinus and lung infections and
yeah, so before Maryland had medical cannabis laws in place, I had seen patients that were immune compromised cancer patients using black market, I guess they call it gray market now because it's but black or gray market cannabis, and getting severe pulmonary aspergillosis, which can be life-threatening because also, you know, when you're with chemo, they were doing it for the nausea and vomiting related to chemo. And you're absolutely right. I mean, as disparate and hodgepodge of all the testing in the US we have, the black market has absolutely no testing at all. And, you know, even talk to patients that that finally had agreed to get cards that had serious immune compromising illnesses that were using cannabis, like bad Crohn's and on immune disease modifying drugs, which lower your immune system. And they were still, you know, they finally, you could talk them into, look, you need to get a medical card, even though maybe it was more money at the time, but it's going to be 1,000 times safer. And as you could see, Maryland's very good. I'm actually very proud of the state. I'm in Maryland now. We've done a really great job with testing. I think we test maybe 8 bacterial components, as opposed to some places only do 3, 4. So, you know, that's the issue, but it's just such a mishmash of state to state what you're getting and what's happening. So that's part of the issue that patients have.
It really is. And most patients don't even know. I mean, I don't think they even think about some of these things. And again, we're not saying, you know, don't use cannabis as a medicine. All we're saying is we need some consistency in the testing that's going on with the states. And here's these states. But they're required by 38 states, making it the most required contaminant test for cannabis. But again, the types and the degrees are all different with all the states.
Right. Yeah. The levels acceptable are different. So what might be considered acceptable level of bacterial contamination in one state might not be in the other state. And then again, you know, because there's different forms of cannabis that patients are taking, right? As we said, you know, we have a fairly robust immune system in our gastrointestinal tract. So what might be an acceptable level, I mean, there should be different levels for different types of products, because what you can, you know, inhale into your lungs with a level of acceptable bacterial contamination, which sounds horrible. You would think there should be no acceptable level, or what you can take internally through your GI tract could be higher. So that's part of the issue too.
And as an example, here is states that require I'm sorry, I can't say the word. Aspergillus testing. So again, like you were saying, it's different in every state. So while you might look at this one and go, oh, look at all that I'm safe, these are the only states that test for Aspergillus.
Right.
And again, the amounts tested vary greatly to state. So aflatoxins.
Aflatoxin.
Aflatoxins.
A.
And otratoxin
A. Yeah.
Thanks. So again, these symptoms: birth defects, immunosuppressant, they can stunt children's growth, liver damage, kidney damage, and possible carcinogens. So something to look out for.
You know, the way you say the elderly and children, I mean, obviously very ill children are going to be in cannabis, but probably the fastest growing demographic in a lot of states when they first started medical cannabis were the elderly, because and they have a lot of chronic diseases. They have more of a chance of being immune compromised as we get older. Even without any chronic disease, you tend to have a weaker immune system. So the people that are most effective are listed as one of the fastest growing demographics, the elderly. So it is critical.
That is true. And here are states that require this testing.
Yeah, this is a toxin that comes from mold. So it isn't just the mold you're testing for a toxin too.
And as we were mentioning, now what can we do to help? So we have 3 things that we're just going to suggest. One is call to Congress to create a National Office of Medical Cannabis and Cannabinoid Control. We call it the OMCCC. The establishment of a centralized regulatory body at the federal level, such as the OMCCC, would work collaboratively with the state governments in developing and implementing standardized testing programs. That's all we're asking for, so that patients, no matter where they live, can have the same a level of safety. This office would provide guidance, resources, and oversight to ensure consistent and effective regulations across the country. We also are saying that asking to implement upstream product safety inspections and certifications, introduce inspections and certifications throughout the cannabis supply chain from cultivation to manufacturing and distribution. These inspections would focus on ensuring adherence to quality control standards, proper handling of cannabis products, and the implementation of good agricultural and manufacturing practices. By addressing potential contamination risk early on, patient health can be better protected. Projects like ACE's patient-focused certification program offer these services to businesses and regulators. And the adoption of comprehensive testing program protocols by state to include the following: accreditation and certification of testing laboratories, transparency and consumer education, very important, as most consumers don't even understand some of these things aren't being tested for. Regulatory oversight and enforcement, create statewide proficiency testing for cannabis testing laboratories, expand access to independent cannabis testing laboratories, and adopt ACE's PFC standards and regulations for supply. Do you guys want to add anything to any of these recommendations?
I mean, it's difficult because it's still federally illegal cannabis. I know this was looking at cannabis, and I know Shelby was involved directly with the research. So actually I have a question for her. Is it possible, did you look at the hemp market at all, which now is legal? Do you see, I mean, I think there are more federal standards that are through USDA and such in the hemp markets. I'm not so, I know that the hemp market doesn't always require a lot of COAs. That's why I tell people if they're going to buy in that market, that's one of the key things to look for, is a COA for any product that they're buying in the hemp market, and see what exactly they're testing for. But I know as far as organics for pesticides, it's a little safer because they can be an organic, they can be a registered organic crop. But this specifically was looking at the states that were selling greater than 0.3% THC products, correct?
Yes, this report was really focused on, like you said, products with over 0.03% THC. I think in terms of hemp, it's really difficult to say just the extent of these contamination, adulteration issues, simply because hemp still has not been approved as a food and dietary supplement. And so it's really regulated as an agricultural industrial commodity. And so the standards there, they're lacking when it comes to consumer safety. And we've seen some research showing how the range of potency really varies across products, as well as levels of pesticides and contaminants and things like that. But I believe there is also a bill that was just introduced federally that would address that within the hemp market, but it wouldn't address the cannabis side of things. So it'll be interesting to see how that plays out.
Yeah, if that plays out well. I mean, I do tell patients too to look for hemp products that actually have their COAs. You'll be able to see exactly what they're testing for: pesticides, heavy metals. Those are the things that I outline for patients. Because, if they're looking for a product that's CBD or CBG, it is cheaper to buy a hemp product than to go into a dispensary and buy a product with CBD or CBG or, one of the other types of non-THC cannabinoids. So, and you can find some good products there, and processors that are creating products where you can get a COA. So that's really the key, but not everybody does it. So you don't go to the gas station, I tell them, and buy a hemp product. You really need to, there's a couple reputable companies out west and in Maine and a couple places that I'll list for patients to go.
Yeah, on some of the websites you can click on the COA and view it right there. And
Right.
I
And it
always tell
should be
patients-
batch to batch testing. You know, I also work in the dietary supplement market, and there's a lot of overlap because dietary supplements is the wild, wild west too. And there's still not a lot of third-party testing, which is critical. The company that I work with actually has one of the first and only USP verified men's health product. So USP is very good. It's expensive, it's onerous, and it requires batch to batch testing, and that's it. You shouldn't just have one COA somewhere on a website from one thing. You should be able to give them a batch number of a product that you purchased online, if it was a hemp product, and go to the company and say, this is the batch. Can I get the specific certificate of analysis for that batch? So you can see what's been tested for.
Yeah, and I have sorry, just two concluding thoughts. And because I definitely want to leave enough time for questions. But the first is that I think this issue is really important from a health equity standpoint. Patients in some states are not getting the same quality of products as patients in other states if they're getting access to legal medical cannabis at all. So that's where I think having this federal oversight would really address that. And in terms of the upstream product testing standards that you mentioned, Debbie, I think this is an important point as well, because there was a study that looked at, I believe it was in Oregon, they looked at the actual vapor produced by vape pens and tested that for heavy metals, and it actually came out having heavy metals that were greater than would have been allowed. And so I'm sure they did their testing on the oil beforehand, but we have to look at how these products are actually interacting with the hardware, looking at things like using ceramic coils as opposed to metal coils and things like that. So yes, I definitely think that's a really important point.
That's a great point. Yes, thank you so much for making it. And just for people that don't know, their PFC is based on USP guidelines. So that is who we worked with on that. And now we're going to open it up to questions. If you guys have some questions, Jeffrey, I haven't been able to look at the chat, so I was wondering if you happen to see any questions you could ask.
Yes, I do. I'm going to be paraphrasing some of these because a lot of these came up in conversation, and I thought they were interesting topics that we'd want to talk a little more about. But Braxton specifically raised the issue around bioaccumulation and pesticides in cannabis, and also the idea about a sort of lack of research around inhaled products, because obviously inhaled changes things. So if you could speak.
It's true. I mean, there aren't, it's interesting to think at one point in time, most medicines came from botanicals, right? Digitoxin came from the foxglove plant. But in the late 1800s, I mean, cannabis was part of USP, and then it fell out of favor, not just because of the Marijuana Tax Act in 1937, but also precision dosing and pills came around about that time. And that's why pharmaceutical companies have switched to synthetics, right? Because it's so much easier to control, okay? So with botanical medicine, having third-party testing, and some issues with third-party testing, which I've seen and heard from talking to companies, you can't be cherry picking either. I've heard of companies that have sent out their products to multiple places and then pick the COA that looked the best for it, right? So the key is for consistency, batch to batch testing, to ensure that every batch is there. Like we said, there should be batch numbers on your product that you get, and you should be able to get the COA. And it is an issue, because that's an issue with all botanicals, whether you're talking about dietary supplements and not. And there are, some unscrupulous companies in the dietary supplement space that might have contaminants in it and fillers and things that could be potentially dangerous. And the same thing in the cannabis space. But it's just critical as a medicine. And since the states have embarked on that, it really behooves them to make sure that they look at best practices for creating products and testing and what they're going to aim for and kind of stick with that.
Absolutely. Is there more questions, Jeffrey?
Absolutely. So we had a question from Claire about why the report did not cover water activity levels in cannabis products. So maybe you or Shelby could speak to that.
My understanding is that the report does cover water activity. Is that right, Debbie? Maybe we just didn't get to it in this presentation.
It is hidden somewhere because I was just looking at it earlier today. So maybe not in as a subject, as a whole subject, but we do talk about it somewhere within the report.
Yeah, because
and a lot of that has to do with the yeast and the microbial growth and things like that.
Check that section. I think that's the section that it's in, the yeast and microbial.
It's in the full report, and this was the abridged version because I read the full report. But water content and water activity is critical because we know, how does mold grow? It grows in dark, dank places. So it affects mold counts, and it can affect bacterial growth too.
But it's a great point.
Yeah, no, thank you for mentioning that. And I do think it's in that mold section because I was just looking at it today. And as I was writing some notes for the webinar, I didn't add that, but it is mentioned in the report. So great question.
Nancy and a few other folks actually brought up issues around testing methods at labs and standardizing those. So I was hoping you could speak to that a bit.
Dr. Vinocur, I think that you could probably answer this one better, being in the nutraceutical space.
Yeah, I mean, there are standards of testing. Like I said, the U.S. Pharmacopoeia has a standardized testing that's required in different products for dietary supplements if they do it. It's interesting. So the U.S. Pharmacopoeia, which was developed, in the 1800s with a group of doctors who were having inconsistency in medicines back in the early 1800s, they created standards. And in 1906, Congress said that all pharmaceutical drugs need to meet those standards. Unfortunately, supplements, dietary supplements, it's not mandatory. It's voluntary, and it's expensive and it's onerous because they have these set standards. But there are national standards in other drugs and medications that cannabis testing companies could follow. But again, it's a dollar thing. And if the laws in your state don't require it, going to far reaches to maybe do some standardized testing. And that's why, if it's ever federally legal, there are federal standards of testing that we see in medications and everything that should be applied across the board. So.
And again, that's another reason why, why we need federal oversight is to standardize these.
Right. Speaking of states dealing with things on their own, we had a few comments and questions around states dealing with like adverse event reporting, legal liability, and also this is kind of related, but I was curious in it, how different states are tackling drug-drug interactions with cannabis and keeping track of those things.
I think the problem is that they're not.
Right.
At least in terms of the drug-drug interactions. What were you going to say?
I was just going to say there is this misconception sometimes, we talk about the wide safety margin with cannabis, but it does interact. Anything you take orally in your body is broken down by our liver in the P450 enzyme system. And we only have so much enzyme that functions in the liver at one time. So patients taking a lot of different medicines, polypharmacy, because sometimes the people that are medical cannabis patients are the sickest patients. They have a lot of medications. taking cannabis, especially oral cannabis, at the same time, it can cause drug-drug interactions. And either you could get a subtherapeutic dose of, say, a seizure medicine that you need to also help you control your seizures, or a therapeutic dose that could be toxic. And I think there's not enough time. That's, that's one of the things I worry about as states start to legalize just adult use, because a lot of people might drop their medical card thinking they know what they can do. There was a study that said only 3% of people excuse me, talk to their physician going into an adult use shop for medical reasons, yet 54% of them talk to the dispensary attendants, who shouldn't be giving medical advice and really need to understand there are drug interactions. But because it's not regulated by the FDA the way pharmaceutical drugs are, there's no mandatory adverse event reporting. I have to say I'm very proud of Maryland, as Debbie mentioned, with our adult use legislation that just started this July. We've created a cannabis public health advisory council to actually tackle a lot of these issues besides diversion, but safety with cannabis and medications and things like that. So I think we're doing a good job trying to tackle some of these things in Maryland, and I'm proud of the state for that. But it's an issue. People think, I try and tell people to separate. It's hard when there's polypharmacy, separate their oral cannabis doses with their regular medicines by an hour or two, because after you've metabolized your regular medicine, the enzymes regenerate, but it takes a little while and you need to have enough enzyme there. But yeah, there are these issues, but the same way there's no federal regulation in the testing and the standards, there's no federal regulations related to that the way there are with pharmaceuticals. And even in the supplement industry, there's no regulation with the FDA. Only when there's a lot of bad outcomes, if people show up in the ER, things can get reported through that, and then the FDA will act on supplements. But they haven't even classified hemp yet as it's not allowed to be a supplement, so they're not even prepared to act on that right now, and they can't do anything with cannabis because they're a federal agency and it's federally illegal.
And again, this is why we created and are promoting the creation of the OMCCC. We need these things. We need these things to happen. We need this to happen. We need federal coordination to protect patients. So the creation of the OMCC is vital to public health in order to have all these questions answered, and to be able to have conformity throughout the states on a medication that is helping over 6 million patients. So.
And if I could just say, I think that this really highlights another big issue, which is that we don't have any required training for physicians and medical professionals when it comes to cannabis and the endocannabinoid system, which is just crazy. I mean, our endocannabinoid system is related to every single bodily function. So I think that the more that we can standardize medical cannabis products across the country, but also promote education among physicians and healthcare providers, I think that'll be a service for everyone.
Yeah, it's true. I think back in 2017, the American Association of Medical Colleges said only less than 10 or 11% of colleges were teaching about the endocannabinoid system and teaching about medical cannabis, yet 2/3 of medical students graduating said they felt unprepared and they wanted to be prepared. So yeah, that's part of what's near and dear to my heart, and what I do is training for clinicians and setting up programs and things for them, and doing lectures.
Wonderful, because it's definitely needed. We only have a few minutes left, so before we maybe ask another 1 or 2 questions, I did want to give a special thank you to Heather Daypray, Jamie Toth, and Shelby Huffaker for helping with the report. And so thank you guys so much for your research and analysis that you put into it. Do we have another question or two, Jeffrey?
Yeah. We got one from Keith Rowe about the way that the integration of adult use and medical systems in some states has affected their sort of testing requirements.
I think, you know, there were some states like California, which I guess Shelby can speak to, but she's kind of young, when they started with the medical and then switched to adult use. There weren't a lot of testing requirements, and a lot of dispensaries opened up. I think, you know, states that came to that later, like Maryland, the way that they stopped all these little shops opening everywhere that were adult use, thinking that they didn't have to have the same kind of standards as a medicine, is that automatically, when it started in the state, every medical dispensary became an adult use dispensary. So they already had the products that they had their specified testing for. And as you heard, we were one of the top, the top states in the country for that type of testing. At the time, it was the Maryland Medical Cannabis Commission that was in charge of that. And they did a really great job. And now, you know, there are laws that say you can have higher THC products if you're a medical patient. There's only tax on the adult use, and there's no tax on the medical patients. And a lot of these dispensaries are still giving priority to medical patients, which is important. That was important to me when the law passed, and I wrote to the legislatures to make sure that the patients don't get lost in the shuffle. But I think that that's an issue, and I think states are kind of just trying to figure it out as they go into those other markets. But certainly there shouldn't be any difference, right? I mean, it's one thing, you need consistency if it's a medicine. You don't need as much consistency if it's not a medicine and you're using it just as an adult to relax, like equivalent to a glass of wine or whatever. But you certainly don't, you shouldn't be inhaling contaminants and bacteria and any of those things. So in that respect, it's just as important, whereas the consistency and what exact cannabinoids are in and how it you respond to it and how your symptoms respond to it obviously isn't critical in the adult use market. But certainly contamination, dangers, pesticides, heavy metals, those are all things, you know, we don't want those in our wines, we don't want those in our food, and you certainly don't want it in anything you're consuming.
And speaking to California, I think that one of actually the greatest benefits, because I did come of age right at the tail end of the medical cannabis market in California. But I remember the days when you could get an edible and have absolutely no idea how much was in it, how much you were going to get in a single bite even. And I always say everyone has an edible story. Everyone loves to tell their edible story. So I would say that we do have better standards nowadays for dosing edibles. You know, they have edibles that are as low as 1 milligram if that's what you like. But I think that one of the other issues that has come up with legalization is just the sheer cost prohibitiveness of medical cannabis in the state. And I know that we have some tax exemptions for medical cannabis patients, but we also, you know, it's taxed along the entire supply chain. So by the time it gets to patients, it's really way too expensive.
Yeah, and I think that that's something that down the road, if it becomes federally legal, some of those things, I mean, look, pharmaceuticals can be way off, you know, we can know how expensive they are for certain pharmaceuticals according to the R&D and everything like that. But I think it'll be something as it becomes federally legal to maybe kind of have those standards. I mean, we are lucky in Maryland, you're not taxed at each stage, like the growing and the processing and the this that all add up, even though there's no sales tax, right, in California for a medical product, but there's still those other taxes, where in Maryland there isn't tax, and there's actually not a very big tax even for the adult use. So maybe as things get standardized more, that will even out. for patients, because that's what patients need. But there's always the hope with legalization that with enough studies and proven benefits, perhaps there may be some coverage with insurance. I mean, I still don't think they're there yet in Canada either. But there are countries like Israel that it's part of their national health system. They have a national health system, and you can get cannabis as a medication as part of the national health system. So, but
And
they're
that
light
is
years,
our
they're
hope
light
too.
years ahead of us.
Yes,
for
but it can
cannabis.
happen and it should
Right.
happen. And for us, that's one of our main missions. We will continue to advocate until
Right.
insurance covers this, because it is a medicine, and just like other medicines should be covered. It looks like we're out of time. I want to thank you guys both so much for being here. And again, please read the report. The purpose of the report is not to scare you off into using cannabis. It's just to be a more informed consumer, and to also understand the need that we're pushing for federal for oversight. The cannabis programs should be safe for consumers, and patients shouldn't have to worry about what's in their medicine depending on which state they're in. We want to increase consumer confidence and consumer education, and create a better industry that we're proud of being a part of. So I encourage you guys to look at the report, read it. There's so much information in it. There's a lot of graphs that we didn't even go over that are in the report, that are in the back of the report as references. If you have any questions, please reach out to us. And thank you again for joining us today.
Thanks for
Thank
having
you,
us.
Shelby and
everyone.
Dr. Vinocur.
Thanks, everyone.
Bye.
Bye.
Bye.